Hello. Hey, everybody. Thanks for joining me during your lunchtime. I really appreciate it. I am Susan Van Dyke, and we're going to talk about hand rejuvenation today. So some of you I've known for decades, some of you I haven't met yet. So just to fill you in who I am, Susan Van Dyke. Yes, I'm an MD. Yes, I'm a board certified dermatologist. And I've been practicing for 40 years in the Scottsdale Paradise Valley area. My practice was Van Dyke Aesthetics, which I sold a couple of years ago, and now I am so happy to have joined Clear Dermatology. And I still do everything I did over at Van Dyke Aesthetics, but in a new environment just down the street. So here we are. My specialty is injectables and lasers. I did practice general dermatology for 10 years back in the 80s and 90s. And then I transferred over to the cosmetic side as soon as they started inventing things that were appropriate for cosmetics. Let me advance this slide. There we go. Luckily, I have a couple assistants here who understand how to work Zoom. So today our subject is hands. Why hands? Well, hands, we don't think much about hands, but I think we all can acknowledge that they give away our age and they're often neglected. You put face cream on, I bet you spend a lot of money on great stuff for your face, but probably not for your hands. Also, hands are the workhorse of the body. They're exposed to a lot of trauma and chemicals. Soap and water. Think about during the pandemic, what your hands went through with all that hand sanitizer. And I know we still use more than we used to, but during that period of time, I bet most of you had cracked, dry, irritated hands. So what makes hands look good? Well, youthful hands have basically two qualities. The quality of the skin itself. So in these hands, you can see they're all even colored, all smooth. And the second is volume. So volume means that not that the hands are plump or fat, but they look smooth, not skeletal. So aging is what's happening to our hands. And there's two different distinct types of aging. And of course, they happen in all of us. The first one is intrinsic. That's where most of the volume loss is coming from. It's the intrinsic aging. And intrinsic aging has to do with your genetics. So you inherited it from your parents. And also how long you've been on the planet. Like, how old are you? Because with age comes aging clearly. So that picture identifies significant volume loss, mostly probably genetics and age. The second type of aging is extrinsic, meaning coming from the outside. This is a result of living in our world and also your lifestyle. The hand on the right shows great volume, but really poor skin quality. Why? Sun, pollution, wind, temperature extremes, lifestyle choices like smoking, alcohol, and also your occupation. If you're a nurse, if you're a hairdresser, that takes a great toll on your skin. So take a look at this picture. I know it's not hands, but it's to make a point. We've got a really nice before and after. Someone's had some surgery, they've had some laser resurfacing, they look great, right? Well, actually, that's not what we're looking at. We're looking at identical twins. They're two different people. And the one on the left has had a lot of sun. The one on the right has taken better care of her skin. And I think it's really obvious they have actually the same intrinsic aging. Look, their volume is pretty good, but the extrinsic aging has been markedly different. So if you don't think sunscreen is helpful, this is here to tell you it is definitely helpful. And the hands do the same thing. So aging overall, your entire body ages clearly. And what's happening, part of what's happening is you produce less collagen and elastin with time. So your best collagen year was 29, except for those of you on the call who are under 29, enjoy what you have now because it's going to start decreasing. And when these proteins are robust, that's what is giving us the firmness, the plumpness to the skin, the resilience of the skin. Also, there's with time, a loss of the elasticity, not just the firmness, but it doesn't stretch out and rebound as well as it used to. That's because of the elastin. And as a result, you develop wrinkles, loose skin, crepiness. And at the same time, remember intrinsic aging, the fat underneath the skin is decreasing. And sun exposure is a big factor in aging. You can see, and I certainly have seen relatively young people with very old looking skin just on the basis of sun exposure. So ultraviolet radiation from the sun actively breaks down collagen and elastin fibers. Not only does it cause skin cancer, and as a result, as we just discussed, yeah, you get wrinkles. But the other side of sun exposure is sunspots. It stimulates abnormal melanin growth in your skin, abnormal cell growth, which can result in cancers and precancers. And more commonly, I mean, well, we're in Arizona, skin cancer here is very common, but more commonly, even with people without as much sun as we get, age spots are exposure related. So why do your hands look older than the rest of you sometimes? Well, your hands take a beating. There's repetitive movement. You're, opening and closing your hands all the time. It's kind of like a neck. A neck has a lot of repetitive movement, and therefore necks show age more than areas that are smooth and not moving. So hand movements can contribute to the appearance of aging hands. As we mentioned, washing hands, frequent washing, especially with hot water, harsh soaps, or removing the oils that are protecting the skin and causing that dryness and cracking. And chemicals are really tough on hands. And what your hands get into, your face is never going to see. This is a lovely progression. This is not real, by the way. This is, computer generated. But from 0 to 4, this is an aging sequence. So over time, you see the progressive loss of volume. So you're seeing more tendons and veins underneath the skin because the contour, you've lost your padding, We're also seeing brown spots developing. Stage 2, there's a small brown spot, and it's getting bigger and bigger over time. So it's a very nice depiction of how your hands change both because of intrinsic and extrinsic together. Now, I would say, because this is grading 0, 1, 2, 3, 4. There's also grade 5 and 6. The older you get, I have many patients in their 80s, and the much more profound volume loss and more quality loss. So, but these are things that we can address, and that's why we're here. So let's talk about quality first. That hand obviously has great quality, perfectly uniform skin. So we're not talking about volume. So in skin quality, what we're looking at is color changes, both brown and red. Brown spots, age spots, liver spots are very, very common, but also unevenness and blotchiness. Easy bruisability happens frequently, more often on the forearms than the hands, but yes, hands too, and that comes with aging and sun damage. Crepiness, fine lines, roughness rather than smoothness, precancers and cancers, and ultimately a very thin translucent skin that you can actually see through. On the other side, we have volume. Babies have great volume, pudgy little hands. Well, we don't want pudgy little hands, but we want more volume than we have. So here's the volume loss patient again. Again, now we're talking just volume loss, not quality of skin. And loss of fat under the skin is what's giving it this skeletal look. Look of prominence of veins because they're not covered anymore. And in fact, as we get older, veins do get larger. But not only that, now you're seeing them better. Tendons, very clear, and even bones underneath. There you go, fat loss, tendons, veins, and there you go, a skeleton on the right-hand side, which matches exactly what you're seeing on the left-hand side. Even the pattern of the veins does track, although the veins are much larger in the older hand. All right, so we've kind of defined the problem. So really what we're here is talk about how you're going to fix that problem. So quality versus volume, and we need both. People say, which should I do? It's like, well, should I paint my house or fix my roof? Well, yes, you should do both. Let's look at quality first. Resurfacing is the way to improve quality. So what is resurfacing is basically getting rid of the damaged tissue and replacing it with healthy tissue. So we've got a couple of great options. Fraxel, Clear and Brilliant, both lasers we'll go into a bit. And then we've got rejuvenating, which is a little bit different than resurfacing. We're not really destroying tissue. We're just stimulating it to behave better. And IPL, or intense pulse light, is in that category. Volume side, we've got fillers, a couple of great FDA approved fillers, but actually many more than I've listed right here. So number one, quality. The deal with quality is we want to remove damaged tissue. And what that does is it encourages the generation of new skin. So resurfacing is what it's called. And how can we do this? How can we remove damaged tissue? Well, lots of ways. We can use physical. I mean, literally, you can use a sander, and remove that tissue. Problem is, it's not going to heal very well. You can use chemicals, and we still do use chemical peels. Chemical peels, though, are kind of all or nothing. They're not that easy to control. Sometimes they're way too deep. Sometimes they're too superficial. And then back on the physical side, micro needling would fall into that category where you're using a physical injury to stimulate new skin. And then we have lasers. Now, lasers are my favorite thing. I think they're far better than physical and chemical because they're much more precise. Healing is better, and I can control them much better. The trick here with any of these techniques is to resurface and bring out healthy skin while avoiding damaging the skin. If you go too far, you get scars. Obviously, this is less than optimal. We don't want to do that. You also want to balance recovery with results and minimize risk. Nobody wants their hands to be out of commission for weeks in order to get a refreshed look. And that's an important characteristic of what we're talking about. So resurfacing lasers. So there's 9 different, basically lasers on the left-hand side, different colors, different depths. So we have a laser, in the world of lasers, we have a lot to choose from as far as choices. Match the problem with the laser is the key. So what a laser is, it's focused light. It's one wavelength of light. It's got little or no risk. I won't say zero risk because it depends on what you have to match the right patient with the right laser, and it has to be done by someone who knows what they're doing. But the reason we can minimize risk with the laser is we can focus on a target and we can adjust energy so that we're delivering the right treatment for the right person. Resurfacing lasers, which is what our issue is today. There are many lasers who do other things like tattoos and blood vessels. That's what we're talking about. Resurfacing lasers come in all strengths. So you can have light, medium, deep, and extra deep. And it has to be matched with your problem and the area of the body. For instance, you can go extra deep on the face. It could be a mistake on the hands. Hands are delicate. Lasers selectively heat up. In this case, the ones we're going to talk about for resurfacing, they heat water. So water is in your skin everywhere, and we can adjust it so that it's hitting water in certain areas to get the target that we want. So it's going to reduce pigment. It's going to stimulate new collagen and elastin by absorbing energy into water, which creates heat, which damages the tissue, which generates new tissue. And ultimately, old skin is replaced with healthier, younger looking skin. And a beautiful side effect of laser treatment, especially in the medium lasers, is sorry about that. Our precancers are reduced, and that's a big plus. So think about it like aerating your lawn, right? You have your lawn, and then you go out there and you punch little holes in your lawn, and that stimulates your lawn to generate new roots and grow new, in this case, grass, but in skin, it's the same concept. We use a laser to make little laser beam holes in the skin, and that stimulates your body to create new elastin, new collagen. It's like, we call it a controlled injury. It triggers your body's ability to heal itself, and that's what we're after. So Fraxel is a laser, my favorite laser on earth. What exactly is a Fraxel laser? Well, it's a laser. It's a moderate laser. It is designed for resurfacing the skin and it can be used anywhere on the body. Its target, as I said, is water in the skin, and it has 2 wavelengths. The 1927, which is named one of the wavelengths, is ideal for more superficial issues, like brown spots, like precancers. And then in the same machine, there's 1550. 1550 is a deeper laser, and it does a better job of collagen and elastin triggering. Now, both wavelengths will do both. When Fraxel first came out, we did not have a 1927. We only had the 1550, and we were getting really nice results. What the 1927 has done for us is improve our results on brown spots and surface issues. When I'm talking about hands, we're mostly talking about surface issues. So these 2 wavelengths, though, can be combined, and we do it on the face all the time, where you're using the deeper one to trigger more collagen, elastin, less brown spots, and the 1927, more brown spots, less collagen and elastin. They can be combined. So you can do both wavelengths at the same time. I typically do not do that if I think the person needs both. And honestly, we don't always need both, but if you do, then I would do the 1927 first and then wait a month and do the 1550. The reason for that is when I do both at the same time, I have to cut down the energy on both wavelengths because it's too much for the skin. But when I do them separately, I can maximize my energy on either one of them. So the Fraxel Dual, has the ability to go deep or superficial, and we want to match it to the problem at hand. So brown spots are very superficial, and you can see that we can keep our laser beams quite high in the skin if we want to. And then mild wrinkles are deeper, moderate wrinkles are deeper yet, and then surgical scars and acne scars. All of these things, of course, not on the hands, but all these things are treated with Fraxel. The deeper and the more aggressive one is trying to be like with a surgical scar or an acne scar. Multiple treatments are necessary. The more superficial things, usually we can do fewer treatments or even one treatment. Benefits of Fraxel, and that little picture is just a little cartoon example of what we just showed on laser beams going through the skin. Benefits of Fraxel: brown spot reduction, age spot reduction, precancer reduction. Secondly, improves collagen and elastin. That means that we get improvement on fine lines and wrinkles. We get crepey skin better. And then you see a significant result with just a single treatment. Now, you can do more than one treatment. As I mentioned, acne, scars, surgical scars, we're going to expect. But when I do a consult with someone, I'm looking at what are their needs, and I try to give a realistic expectation to where you're going to see your results. So Fraxel procedure on the hands, very simple, really. We cleanse the hands, we apply a numbing cream, which is amazing, this numbing cream. And we might let you sit there and numb for an hour, hour and a half. Actually, sometimes 30 minutes is all you need. The treatment typically lasts 15, 20 minutes, pretty quick. You're going to have mild to moderate discomfort during the treatment, kind of like hot little needles. That's where the numbing cream is really helpful. And afterwards, sunburn type sensation, and it goes away pretty quick. So right after the procedure, you might feel that your hands are burning, but by the time you get home, you kind of forget. And then redness and puffiness is very normal for a number of days afterwards, and peeling and flaking follows that. And that's the new skin that's pushing out the old skin. So good riddance. Post-care, it's very simple. I like Elastin Skin Nectar. That's a particular product. We use it a lot on Fraxel on the face because it stimulates your immune system to reabsorb the damaged tissue. Now, the damaged tissue is your sun damaged tissue, yes, but also the damaged tissue that I just caused with the laser. So it helps healing. Things heal faster. And mild redness, swelling, normal, temporary. I would just tip to remember, if you get this done, avoid hot water. I had my hands done one time. The time I got home and did a few things, I actually had forgotten I'd had them done, and I went in to do the dishes and plunged my hands into hot water. That reminded me, it's like a sunburn. If you put hot water in a sunburn, it doesn't feel good. And that's the same thing. Afterwards, you want to avoid direct sun exposure and use sunscreen. Actually, it'd be nice to put sunscreen on your hands all the time. It's kind of hard to do that because you wash them all the time, but it's good advice. And then your results are happening. Usually you'll see them in about a week, but they can improve over time. So there you go. Here's some examples. Crepiness and brown spots. This is 2 Fraxels. I've seen results as good, if not better than this with one. Again, it's independent on individual patients sometimes. My go-to on hands is usually one treatment, but we could do more. There's another one. Quite nice on everything. I mean, the brown spots and the crepiness responded beautifully. And yes, we do the fingers. So you notice her fingers look better. A little bit older patient, more significant brown spots. Don't judge the volume. We're not doing anything with volume in these patients. These are all quality. And yes, we would want to do volume on this person. And then here you go. Again, don't judge the volume, but if you look really closely, you can see those horizontal wrinkle lines significantly better. In some areas, they're actually gone. And Fraxel, anywhere on the body, for sun damage, pigment lines, wrinkles, scars, stretch marks even. You have to be evaluated to decide whether it's appropriate for you. Sometimes lower legs are not appropriate, depending on what's going on there. Older people with bad circulation on legs, I would not do lower legs, but pretty much everything else. Our most common areas are going to be face, neck, chest, hands, certainly, and I do a lot of forearms. So everything I'm telling you about hands is the same on forearms. And sometimes we do the whole arm. So what's another option? A different option for Fraxel is Clear and Brilliant. Clear and Brilliant is an acute, kind of looks like a little original Apple computer. But Clear and Brilliant, I kind of call it baby Fraxel. It's a similar experience. The insides, what the machine is doing is fairly similar, but it's only 1/10 the energy. So it's a gentler laser. It's on the low intensity side, and it's designed to improve skin tone and texture. So it's targeting really the early signs of aging, and it's about maintaining youthful skin. I think of it more of a maintenance or preventive kind of treatment rather than a aggressive treatment. I prefer to do a Fraxel and then maybe follow up with some Clear and Brilliant sort of as maintenance. But it is suitable for all kinds of skin, and there's no downtime. I mean, you have pinkness for maybe the rest of the day. Multiple treatments can be done every 2 to 4 weeks. And frequently you do want to do multiple treatments with the Clear and Brilliant. So you get improvement in the tone and the texture, improvement in appearance of fine lines, creepiness, and the early signs of aging. So Clear and Brilliant is one treatment okay? Sure, one treatment is okay, but not necessarily recommended. You really want to give you kind of a series concept. It's a great refresher after Fraxel treatments. I call it like polishing the apple, kind of keeping things fresh. And this goes for face too. Everything I say, can go for anywhere on the body. It's an ideal entry-level laser. In other words, we have someone who's like a little afraid of lasers or not sure what the whole thing's going to be about. It's a great treatment to just start with, and then we can transfer to Fraxel if we wish, or continue with Clear and Brilliance. Series of 6 treatments is not unusual. As I said, 2 to 6 week intervals is great. Redness for a couple of hours, dryness, flaking maybe for a few days, and you can put skincare on, sunscreen, whatever, really immediately after the treatment. Procedure itself, very much like the Fraxel. We cleanse, we numb. Treatment is done, 15, 20 minutes worth, and then during the treatment is minimal discomfort, maybe a gentle warming kind of sensation. Post-treatment, very similar to the Fraxel again. Don't necessarily recommend, I mean, it's fine to use it, the elastin nectar, but a gentle cleanser and a really good moisturizer is fine. Redness is temporary, avoid sun, and gradual improvement over time. Here's another option. I mentioned this earlier. This is more of a rejuvenation than a resurfacing. So you're not removing tissue with an IPL. IPL is intense pulse light, is what it stands for. It's similar to a laser, but it's using many, many different wavelengths of visible light at the same time. It's not being absorbed by water, it's being absorbed by colors, specifically red and brown, which is melanin. So if you have broken blood vessels, that's red. It will be attracted to it. It's a great treatment for broken blood vessels. Also brown, if you have predominantly brown spots, melanin, it's going to be attracted to that. So good for brown spots. Heat is generated when the light is absorbed, just as with the Fraxel, but that's water. This is pigment. And then the heat itself is damaging the tissue, which is what's going to reduce the red, which is superficial blood vessels. And it's going to reduce the brown, which are like the brown spots and discolorations. This one, we're reducing age spots and discoloration. We're improving tone and texture. It's non-invasive, requires really minimal downtime. You do have the ability to treat individual spots. You don't have to treat an entire area, whereas Fraxel and Clear and Brilliant are really designed for entire areas. And it does promote collagen. It's not really going to have an effect on precancer. So in significant sun damage, I'm going to prefer the resurfacing rather than the rejuvenating. If it's predominantly broken blood vessels, absolutely IPL is the choice. Procedure itself, you've heard this before. We clean the skin, we numb the skin. We do that in everything. It says it's applied for 3 to 45 minutes. Well, that's a typo. So 30 to 45 minutes. Cooling gel is applied. The IPL device is applied to the skin, and little beams of light are dispensed. Kind of feels like a snapping sensation. Can be 20 or 30 minutes, but usually 15 to 20 is adequate. And generally we do the whole hands rather than individual spots, but it's definitely amenable to individual spots. Multiple sessions recommended for optimal results. And after, the care afterwards, I'm going to get you to remember this stuff. You avoid direct sun and sunscreen. You want to use sunscreen, of course. Moisturize the skin. Redness and swelling are very temporary. And then continuing follow-up sessions are very helpful in improving and enhancing. All of these procedures, the results build on each other. Each additional one you do, you get better results. So here's a couple of befores and afters. So the volume, I think the volume looks different on this, probably because the hand is being held in a little different position, but IPL is affecting, it's the crepiness you want to look at and the brown spots. And there's not really a lot of red in this person. And here's another before and after with IPL. Really nice result. On the picture on the right, which is the after, if you look closely, excuse me, you can notice 3 red spots, maybe 4. And then if you look at those corresponding areas on the before, they're brown. So that red is coming from treating those individual spots a bit more aggressively than the whole hand. Therefore, you're seeing more inflammation, more redness, and that'll go away. And there's another one, beautiful result, nice crepiness improved and overall skin texture better. And one more. I like showing a lot of before and after pictures because they're all different. You're going to have a different result than anybody else. So when we show you a bunch of before and afters, you want to pick someone who looks like you. It's not okay. I mean, it's not possible to go, well, I want that result. Maybe that's not you. So we that's part of the consultation is expectations, which is the right procedure, how many procedures is appropriate for you. So let's talk about volume real quick, and then I have a treat for you. We're going to do a demo on volume in a couple minutes on a real live patient. So adding volume back is what we want to do. Replacing lost volume, traditionally, it says fat loss, but traditionally you replace fat with fat. So fat was liposucked off of some area of the body and then re-injected into what area is deficient. It's a great technique. There's a number of problems. It's 2 procedures. You have to overcorrect, so you get kind of the mitten effect, too puffy for a while it settles down. And it's very hard to determine how long it's actually going to last because it's really a tissue transplant and it's up to your body whether it's going to accept it or not. It's so much easier with modern fillers. We have a limitless supply. We just have to open a cabinet to get what we want. And very simple to do. There's not a second procedure. And some of the fillers we use, actually the ones that I favor, completely reversible. So if you got an issue, you don't like it, whatever, we can reverse it with a little enzyme. FDA has approved 2 hand fillers. One is Restylane Lift and one is Radius. Restylane Lift is an HA filler, high hyaluronic acid gel. Juvederm is another common one, which I'm sure you're familiar with, Restylane and Juvederm. This particular one gives a nice lift and lasts about a year. It is completely reversible. Adverse event, exceedingly rare. You can have a nodule later on, but again, very, very rare. If that occurs, then we can treat that. And then Radius, different material entirely, is called calcium hydroxyapatite. It lasts about a year. And the one thing that I consider when thinking about that, it's white, so it is visible. If you have translucent or extremely thin skin, wouldn't be my choice. And then again, with it, very rare would be to get a bump and they'll resolve in time, but again, unusual. So what is the filler procedure, which is what I'm going to show you in a minute. Areas cleansed and numbed, and then I make a little poke, where that red spot is, that red X is on the hand, that's the back of the hand. And then I use a cannula, which is like a needle, only it's not sharp, it's dull on the end. And I put it through that little poke hole and very gently guide it underneath the skin, not painful really. And then I inject it into the areas of volume loss. We massage it, it's all done. It can take 5 minutes. So what does it look like? Here's some befores and afters with Restylane. You can see less skeletal looking, nice volume, one treatment lasts about a year. It's another patient, you see between the tendons, the veins are less prominent, less skeletal. Now, usually I'll use one syringe of filler on each hand and have someone come back in a month or so and then reassess and decide if we want to do a little bit of a touch-up. This person I'd probably do a little touch-up on. Some people don't want to do two, they're just nervous, and that's fine. We'll do a half a syringe on each side, but I'll tell you 95% of people that I do that on come back in a month and we do the other syringe. Here's another where the tendons are much less visible. And here's a radius. If we go from left to right, A is the before, right hand, left hand. B, the second column, is 3 months. And then the last one is 6 months. So you can see there's pretty good staying power. And again, this is radius. So what we're going to do, I'm going to go over some specials with you in 1 second, but hang around for a few minutes after I talk about the specials. We'll leave this slide up with the specials so you can look at them. And we're going to go and move into the treatment room and show you a demo on HA filler replacement. So there are our specials. See you in a minute. Don't go away. Do you have the iPad? You see me?
Yes.
Hi, we're back. All right, so now we're going to do demo, and we're going to focus on hands right now. So let's go turn the camera to the hands. I'm going to show the right hand. We did this hand, I did, her hand with filler about an hour ago. So you can see that after the treatment, now we're talking volume, not quality, so we're just looking at volume. You can see the little poke was right there, but this is what you look like when you leave, which is perfectly normal. I'm going to show you her before. So you can see, I think we've done a really good job of improving volume on her before and after. And again, I just did this an hour ago. Does that show up well? Okay.
Yeah.
All right. So now we're going to do our other hand, and we'll do that live. How you feeling?
Good.
Good. Just so you know, it's a real live patient. So she's already been cleansed. I've already cleansed my hands. So we're all good to go. She's had some numbing cream on for a while. I have a different pair of gloves, please. That's a little, sorry. Notice our signature pink gloves. They help everything. Oh, we are going to answer questions after I'm done. So if you have questions, I think you can type them into the chat, and one of the girls will read through them, ask me some questions. My email, I didn't point this out, is SVD. That's my initials, SVD, at my name, SusanVanDykeMD.com. Feel free to text me, sorry, not text, I guess, email me with any questions you might have if you don't get them in. All right, so we're going to do just a little kind of a pinch. I said we've done numbing cream already. And then I use a cannula, which is kind of like a needle, but not sharp. And it goes right under the skin. Now she has thin skin, so you can actually see it. What I'm going to do is just very gently fill some of these spaces with my filler, which this is Rest and Lift that we're using. I'm going to have you pick up your hand. And we're going right between the tendons and the bones, so in those little webby spaces. I come back and go back in again. Linda, you okay?
I'm good.
Okay. So it's weird feeling, not really painful, just weird. There is an anesthetic in this, so it does get numb as we go. And this is the HA filler that is reversible if we wanted to. And the reason to do cannula is, there's a lot of big veins in there. So if I bump into a vein, it's okay. Generally speaking, it's just going to bounce right off and not cause any problems whatsoever. Worst case scenario, we could get a bruise. And we're almost done. See, I don't even think that was 5 minutes, huh? You don't even need a lunch hour. You just do it on your coffee break. And then I just massage, and sometimes the massaging is the most uncomfortable. But there we go. All done. And she's got that little, we have a Band-Aid. A little tiny pokey spot. You can hardly even see it. Get yourself a nice Disneyland Band-Aid or something. And that's good. Okay. So do we have any questions that we want to answer? All right. So remember my email, svd@SusanVanDyke, MD, don't forget the MD.com, and I will get back to you.
When you use filler in the hands, what about the fingers?
So can you put filler in fingers? Sure, you can. I've really not seen the real need to do that, honestly. You would have to be careful. The fingers are a very small space, and if you fill it too much, it's going to be compromising the blood supply. So it's not really an area that is typically done. If necessary, maybe a small amount and then do it on multiple occasions. Yeah. So thank you. Rather than try. And that's kind of my philosophy on life anyway, is maybe someone needs 2 syringes on each hand. I don't do 2 at the same time. I'll do 1 at a time and then come back in a month and see if we need more or not. It's a great question, though.
One question about Fraxel.
Mhm.
Does it slow down the decrease in volume at all?
Does it slow down? So Fraxel, no. Fraxel is not going to penetrate through the dermis. The dermis is actually the skin. The fat is underneath the skin. That's why they call it subcutaneous, under the skin. So Fraxel will not affect fat one way or other. It won't increase it, won't decrease it. It's neutral on it. In fact, we can do, and we can do this and do Fraxel immediately, in one sitting. It doesn't hurt the filler. It doesn't touch the filler.
How long does the filler in the hands typically last?
It lasts typically a year. So if you look at the studies on longevity of fillers, say in the face, and these are FDA approved for the hands, of course, a year is about right. I will say that whenever I tell you something lasts a particular length of time, I recommend touching it up at half that time, because you don't want to wait till it's all gone. And when you do the roots in your hair, you don't want to wait till it's all gray, unless you don't want to color it again, to touch it up.
How do you decide to use laser or cryotherapy for brown spots? Are they equally effective?
No, they're not equally effective. They are effective in totally different ways. So brown spots that are raised, like seborrheic keratoses or warty type things, liquid nitrogen cryotherapy is definitely the choice because it's going to actually destroy that tissue to a deeper level and the whole thing will peel off. When you have just flat brown spots, you can use cryotherapy. It'll work fine, but it's a spot treatment. So you're doing individual spots. So I tell people if you've got, say you have 4 or 5 spots, it's fine. But if you've got 100, then, you know, especially on a hand or something, it doesn't make sense to do them individually. The other thing about cryotherapy or versus laser, we're resurfacing the whole area. If it's a hand or a face or a chest, that whole area has been in the same place for the same amount of time, same amount of sun damage. It doesn't make sense to just individually treat spots, especially in an older patient, when their problem is sun damage everywhere. You want to kind of treat the entire area. Otherwise, next year, you're going to come back and do more individual spots. So that's a great question. Fraxel is definitely superior for precancers in a large field as opposed to individual spaces. It's really good for individual precancers. Don't get me wrong. It's a very good treatment. But when you want a whole area, and also it's good for preventive. So you wouldn't like freeze someone's entire hand or face with cryo, right? That would not be a good idea. These are great questions that can be answered on an individual basis when I'm looking at a person and saying, well, I think this is the pros and cons of going this way or going that way. So that's an overlapping thing too. Well, great. Well, it's been fun being with you. Thanks. And I look forward to hearing from you.